Hey, sir, we live? Hey, guys, this is Bobby Clue, Somerset-Pulaski County Chamber of Commerce. We are back at it again. Another one of our virtual ribbon cuttings. We're out here today in Nancy, my old stomping ground, and we're at Gratitude Adjustments, and I'm going to say it right. It's Gratitude Adjustment Integrated Care Clinic. I know Gratitude Adjustment. Integrated Care Clinic. I'm here with Stephen Brands, Christy Fox. Thank you all very much. So Stephen, owner, Christy, owner as well. So I'm here with owners of thank you all for taking a second to talk with us a little bit about your business.
Sure. Yeah.
Yep.
Thank you for being here.
Well, we're out in Nancy. Tell us a little bit about Gratitude Adjustments. What are the services that you guys are providing?
Well, we are an integrated care clinic.
What does that mean?
That means that we have brought all services under one roof to provide the best care that we can for our clients. So we provide behavioral health counseling, which means mental health counseling. We also do substance abuse treatment. If a person has a DUI, we do the treatment for the DUIs. We provide medical care, so family medical. We have a family nurse practitioner on staff. We have a psychiatric nurse practitioner on staff. She does all the psych meds. We do medically assisted treatment to help people come off of substances. We have case management. We have peer support to help people on their journey. And we also have 3 sober living homes. We have male and female sober living for those that are struggling with substance abuse. So the reason that we did the integrated model is just so we can treat the whole person, and not just a piece of the person. We want to do that integrated care to truly try to help that person.
It sounds like it's a one-stop shop kind of a program that you've put together, which makes you probably a little unique in the scheme of things.
Yes, and we also do massage therapy and Reiki therapy. So I forgot to mention those.
Right.
Those seem to be everybody's favorite. And if a person wanted to come participate in services here, they can participate in any service. They don't have to do all the services. If they just want to come do a massage, they can. If they just want to participate in the medical services, they can do that.
Right.
Or they can do the integrated approach where we help with all the pieces.
So to give you everybody a frame of reference on where we're at, we're out in Nancy on West Highway 80. We're right past Thompson Drug, a little past I'm trying to think. So you told me, I didn't even think about this. This is the old Warner Fertilizer
building,
which is super cool. It certainly does not look like their old building, but that's where we're located at. Could we go inside and just take a look at the? It's such a pretty building. I'm going to follow you guys, and we'll and I want to we can talk about some of the facility, the services and different things that you guys are doing.
How would you like to?
Well, what flows best? You want to go this way and just do a walkthrough? You want to go this way?
So when you're in the waiting area, this is typically the medical area over here, and
let's
so
go take
everything
a
is
look at the
behavioral health.
Let's take a look at it. I'm going to follow you guys. So how long have you all been out here now?
Since September 22nd is when we opened the doors in this building.
September 22nd.
Yes.
Okay.
Of course, we have some reception. The lab, she's not in here right now, but we do have full lab services as well.
Sure.
You don't even have to be a patient here to come have lab services, just your lab order. She's got that locked up where she's not in here right now.
Tell me this. I like a good origin story. How did the two of you connect to have this come about?
That is a story.
Where were you all at? And then you probably doing something in this realm, right? And then you said, hey, we need to collaborate. We need to do our own thing. How'd that work?
Well, she pulled me in.
I pulled him in because I'm clinically minded. He's business minded. And so we actually met years ago. We both worked at Lee's Ford Marina.
Really?
And,
yes.
He was the CFO. I was a manager up at the restaurant.
We know the marina's for sale. Maybe you can go and do a little more.
Right.
Just
no.
I didn't know that. But, he's always been on my radar as part of my vision. He just didn't know that. Mm-hmm. And I opened the practice in 2019, and it was just me. And, I took several years to learn it and make sure I knew the ins and outs. And then when I was ready to expand, I needed somebody with a business mind while I was focused on the clinical. And so that's when he came
Wow.
on in 2023.
2023,
And
yeah.
that's when we really started expanding all of our services, and then, moved into our new location a couple months ago.
What a great story. See, that's a
Yeah.
good story. That's what I wanted to
Yeah.
hear.
Yeah.
Yeah.
Yeah, very cool. Well, let's keep going. Let's
Okay.
keep checking it out.
So like I said, like this side is all medical. We have exam rooms here, MA room where you get your vitals.
This is a big building.
It's a huge building.
Holy cow. It doesn't look that big from the way. I mean,
There's
it's
a
huge.
story to this as well. Christy, when we bought this place, this was all warehouse back here. So we came here and we chalked out rooms, and we decided, this just isn't enough space, or she said. And so we thought we would build out as well, or she was wanting to build up somehow. And then when it all got framed in, we were like, we have a lot of space. But we had filled it up already. So
Yeah.
So we have a lab bathroom back here. Our medical director's office is right through here, which she's here as well in the group room right now.
Okay. So, do most of your patients, are you seeing them, do they come from Pulaski County or just the Lake Cumberland
Russell
region? So they come
Springs,
from all over the place?
Everywhere.
And are they referred to you from doctors a lot of times, or how do they find you?
Not from physicians, really. Like a lot of times, like Department of Corrections will refer somebody here.
Sure.
We have some drug court.
Drug court.
situations. Yeah.
Some of the rehab facilities probably are they referring you guys as well?
Some.
Yeah, we have clients that come to us all different ways from all different locations. We have some that come from Wayne County, Macquarie County. We offer telehealth options as well, so we have a lot that do telehealth. But we have some that just need help in life, that they've reached a point where they need to process trauma or their anxiety's taken over. And so either we do have some physicians that refer here. If they've worked with their client and they see that they have anxiety issues or depression or bipolar, they'll send them over to do the treatment behind that. Because medication can do part of it, but then you've got to, implement the therapy with that as well. So we have people that are from all referral sources.
Okay.
We accept anybody that would like to do some self-work. We welcome them in.
I always think about, how do people find, good people like you? How do they know you're here? And it's probably a combination of word of mouth and referrals, and somebody's been here and you did some great work, so they're referring a friend, and hopefully some people just kind of finding out about you today. It's a little bit of everything. It's kind of how this works. So.
I've been in this field for 20 years, and so word of mouth has been very important for me. I pour my heart and soul into helping people, and we are very client-centered as a whole team. Everybody in the building is very client-centered.
Sure.
And so, thankfully, word of mouth has, brought a lot of people in our door.
Well, Christy, I know a lot of the good work you've done here in this community at the prison here. I know a lot of the work you've done, and I mean, it's you have a lot of fans in this community for the work you've done.
We take that very serious. If somebody comes through our door asking for help, we really take that serious.
Absolutely.
We're here for them.
That's great. Well, we'll keep cruising. It just keeps going.
It just keeps going. And so this is just our staff kitchen area, rest
sure.
area.
And so this side, health, and then what is the other side?
Behavioral health and massage therapy, Reiki.
Okay.
There's all kinds of stuff.
We probably should go take a look at that too.
Let's check it
Let's
out.
get on down the hall.
Yeah.
This is how we get our exercise during the day. Thank goodness it's way away from my office.
So here we start, basically with like a small group room. They may, conduct some DUI classes, anything more than one person they may handle in here. Some therapist rooms, targeted case management.
When you say DUI classes, I know we're recording, but is that something the court orders you have to do if you get a DUI? Is that what happens?
Yes,
and then you have to find somebody that is licensed to be able to provide you with those? Okay.
Mm-hmm.
Yes.
Yeah. Well, I'm sure there's a lot of business just there.
There is. Yeah.
So you probably work with the courts as well to have people
do.
know that you're
Yes, we do.
here.
Yes.
Yep.
And those services are available. That's great.
office is down through here.
So how many therapists do you have here currently? Do you have a rough idea?
Probably with telehealth, like some don't even live here in town.
Right.
A couple don't, and
I think we have 5 fully licensed therapists
Yeah.
and 2 at the associate level.
Yeah.
And then we have 2 or 3 that solely do substance abuse treatment, so that's a different certification. And then, like I said, we have a nurse practitioner that does all psych meds and MAG
Right.
treatment.
we have an
So-
intern currently who is a veteran, and so he's able to work with some veterans
Yeah.
and offer some specialized services there.
Well, I mean, I'm sure there's probably a lot of things to unpack, with
the
veterans.
trauma-based with, yeah.
Absolutely, yeah.
Yeah.
No, this is.
Yeah.
You've got a full house. So you've almost outgrown this already, huh?
We filled it up quick, it filled up really fast.
Well, that's a good problem to have. You're on the
Yeah.
business side. You're just going to have to find out how to build another one now.
So this is the healing center, as Christy likes to call it. This
Yeah.
is the massage therapy room, a Reiki room over
Gotcha.
here.
And that's something that's pretty unique to what you guys are doing here. A lot of people might have some of these services, but they certainly wouldn't have massage and Reiki. You'll have to tell me. You'll have to.
That's her
excuse my
specialty,
ignorance.
yes.
I don't exactly
Reiki
know what that
energy
is.
Healing.
Okay.
I use that in a lot of trauma-based work because trauma is stuck energy in your body, and so Reiki is a practice that goes in and helps move that energy through a person's body.
Okay.
So it's just a hands-on treatment, a light touch, and it has great results.
Wow,
to it.
okay.
Yeah, a lot of
I've heard the name, but I didn't really know what that
issues. Yeah,
was.
It's really good.
Yeah,
So this is
Our
the
Reiki room.
that's neat.
you detach from.
All right. Well,
And of course, we have a big group room up here where all kinds of activities go on, classes.
Right.
That's where the spread of food is that
Okay.
we're all waiting to eat.
We do intensive outpatient
Yeah.
treatment as well, which, is if a person has completed residential treatment, it's recommended that they step down into intensive outpatient, and so we do intensive outpatient as well.
Well, I know that we're going to have a lot of people watch this, and they're not going to know how to get a hold of you all. If they want to learn more about gratitude adjustments, how do they do that? Do you have contact websites, social media? How do we get a hold of you all? Can
have
you
all that.
let us know? What are those?
We have, obviously, we have a Facebook page.
And I think it's gratitude adjustment, isn't it?
It is, and the website address is gratitudeadjustment.org, and they can always give us a call at 606-288-0013.
Great. Well, I think that's half the battle sometimes is to, learn the services that you're providing because they don't know, and then, make sure they know how to get a hold of you. Those are the things I consistently hear from people is, I didn't know that they were doing that.
Yeah.
And then, and what we'll do is in the comments on this, we'll make sure to put all your contact information
Okay,
on
thank
there
you.
as well. So I just want to say thank you to both of you all for a few things. First of all, thank you for being chamber members. I really appreciate that. Thank you for being a small business owner and giving back to our community. We appreciate that. And thank you for all the great work you're doing. Thanks for being in Nancy too, just from an old Nancy guy. I appreciate that.
Well, we
I
really
appreciate
hope to
that as
benefit
well.
our community out
Yeah,
here.
absolutely. Well, guys, we have got a ton of people that have showed up out here, and we're going to go do an in-person ribbon cutting to celebrate their grand opening as well. So until the next time, I want to thank you all very much for tuning in. Talk to you soon. Thank you.